Hi, my name is Valdo. I'm a student nurse and I will be showing you how to reconstitute and dilute a medication and then to administer it via a mini bag. So prior to this, I have compared my physician's order to the MAR, and I have seen that the physician's ordered methylprednisolone, so I've compared that to the MAR to make sure that it is the right medication. So before I start, I'll wash my hands and I will grab this medication from the Pixis machine and I'll go ahead and do my first check. So this medication was ordered for Whitson Emma. So this is Whitson Emma, and this patient is allergic to morphine. This medication is methylprednisolone, so it's not a problem. So methylprednisolone, and the order is 75 milligrams. This medication is going to be given IV, and the frequency is every 6 hours, and the time would be now, which is 1400. So I have done my first check and everything checked. So I will just put this away and look at my monograph to see what this medication is for and how it can be administered. So methylprednisolone is a steroid, and the maximum and it can be administered by a nurse or a student nurse. The maximum daily dose is 1 gram IV times 5 days. For other disorders, this medication can be used for 40 to 250 milligrams every 6 hours. Or for spinal cord injuries, it can be used 30 milligrams per kilogram, or for maximum single dose 30 milligrams per kilogram. So this patient is getting 75 for every 6 hours, which is okay, well within normal ranges. And this medication is compatible with normal saline, which is the fluid running the patient's room. So I know my medication is compatible. And some potential hazards to watch out for these medications are sodium retention, edema, increase of glucose level, or peptic ulcers not healing. So I'll just make sure I educate the patient of these signs. So I have checked my monograph. I'll go ahead and prepare my medication now.
And I will do this for 30 seconds.
So this medication will be diluted with, I have checked my monograph, and this medication needs to be reconstituted with sterile water. So I will be cleaning my vials. I'll clean that for 30 seconds and let them dry for 15 seconds to clean both of my vials.
So I can clearly see on the line
For 30 seconds, let it dry for 15. And while it dries, I'll just prepare my syringe and making sure I'm not touching the end to maintain sterile technique.
Air, so that I can put
So I need 2 milliliters of sterile water to reconstitute my medication. So I'll just draw 2 milliliters of air into my syringe. I have 2 milliliters of air.
The 1.8.
Okay.
And I'm going to tap it.
So for this reason, I will just re-clean my valve because I fear that it might have been contaminated when it turns. So I'll clean that again for 30 seconds and let it dry for 15. And then once it's dry, for the purpose of this video, I will inject my 2 milliliters of air into the syringe. So inject my 2 milliliters of air, and then let the pressure feel.
And I'm going to recap.
So I have 2 milliliters of air.
I've already cleaned my
Just get rid of my bubbles here to make sure I have the right dose. Okay, so I have 2 milliliters of air here, and then I will instill that in my
I'm going to
medication.
pull out the air.
And once I do that, I'll just let the air fill back into my syringe. Okay, I will gently roll this in my hands to make sure all the medication is dissolved.
So that the powder
Okay,
dissolves
so
within the fluid.
now I see that my medication is well dissolved and I can go ahead and draw my volume. So for this purpose, for 75 milligrams, because this vial is 125, for 75 milligrams I have made my calculation and I'll be drawing out 1.2 milliliters to get my dose. So I will then put 1.2 milliliters of air in my syringe to get my required dose.
2 milliliters out of my 2 ml vial. So I'm going to
So I'll inject 1.2
put in
milliliters.
1.2 of air.
and let the pressure fill in.
I'm just gonna clean it quickly, just to ensure that after I rolled it, that I didn't contaminate it again. Just to be sure.
And then I'll
For 30
just
seconds,
get
let
rid
dry
of all
for
the
15.
bubbles. And I have 1.2 milliliters here. Okay, so I have my medication. Before I go ahead and dilute it with my normal saline, which is my diluent for this dose, I will do my second check. So I'll get my medication, my vial, and before this I already made my medication label, so I will use all this to do my second check. So right patient with Whitson Emma, and the medication is methylprednisolone. I have here methylprednisolone, and the dose is 75 milligrams, which is equivalent to 1.5 milliliters. And this medication is going to be administered via IV. I'll be giving this in a mini bag IV. Frequency is every 6 hours, which makes the time 1400 now the right time to administer this medication. So my second check is done, and my medications are ready. So I can go ahead and inject this medication in my syringe. But just before that, I will clean my port to make sure I am maintaining sterility.
Okay. So now I'm going to do my
So I'll
second
clean my
check
port
before I
here
go
for 30
further.
seconds.
So my patient
Now let that dry for 15 seconds as well.
using my vial,
And once that
my
is
syringe,
dry,
and
I will go ahead and inject my
I'm going to
medication.
set my patient's emma. Hydrocortisone is the medication. So I have hydrocortisone and hydrocortisone. The dose is
And
150
once that is
milligrams.
injected,
So here I have
I'll just put this in the sharps.
I
And now
take
gently roll this to
150
make sure the medication is well mixed. And I'll just put my label on it.
Calculation. The route is IV, and this is an IV vial, and this will be given IV. And it
I have
will
my
be given
label
every 4
here,
hours,
so
which
I
is
will be
after.
getting everything I need ready
So
to
looking at
administer the
my
medication in the
fever
patient's room.
chart
So I have my medication,
I need
I have my
10
tubing here,
hydrocortisone,
I'll need an
sodium
alcohol
sesame, I
swab,
need 10 ml and a 10 ml syringe.
and I'll need to
So
label
I
my
already
tubing
have
as well.
1.2 ml.
So I will go to the patient's room
So
with my
taking
chart.
10 minusing
I'll go to the
1.2
patient's room
and
with my MAR,
of
to make sure I'm doing my third check and make sure I have the right patient. So as I enter the patient's room, I will just scan for any safety hazards, see if the bell is well off, and check for the solution that is running. I have normal saline running here, and it's the right solution that is running and it's compatible with my medication. I'll check the tube for patency, and I'll check the date of the tubing to make sure it's not expired. So I'll check the date and the time that it was started. I'll just check to see if there's no bubbles and that everything is running fine. Check the side as well for any redness, any pains. And then before this, of course, I would have introduced myself to the patient and told him why I'm there. So, hi sir, my name is Valdo. I'm a student nurse and I'm here to administer your medication. It is methylprednisolone. That's for your information. So I'm here to administer that, and like we've discussed before, some side effect of these medications can be an increase in your blood glucose and your ulcer not healing properly. So you can just monitor for that. I will be checking on that as well. But let me know if you feel any differences, okay? So I'll go ahead and administer your medication now. But before that, I just need to confirm. Can you please tell me your name, sir? Emma Watson, okay. And how old are you? 30 years, thank you. And do you have any allergies at all? You're allergic to morphine, okay. Thank you. Okay, so this is my right patient. I'll just do my third check as well to make sure that everything is fine before I go ahead and put it on the pump. So Emma Whitson, I just checked that's my right patient. They are allergic to morphine. This medication is not morphine, so we're good to go. So methylprednisolone, and the dose is 75 milligrams. The route is IV. This is going to be IV. Frequency every 6 hours, and the right time will be now, which is 1400. So that is good to administer. So I will then first I will bring down my primary IV, my primary fluid here. Now close my clamp here to make sure that while back priming, I don't lose any of my medication. Now gently close I'll gently open my cap here and spike my tubing, making sure I'm maintaining sterility. So once that is open, nothing has to touch it.
Here's
I put my spikes there.
And now I'm going to draw back.
I'm gonna put my medication.
I'm going to throw
So
this
I have
into
my
the sharps
medication.
container.
I'll just hand that
I'm
there.
going to put my medication.
And using an alcohol swab, I'm just gonna clean my the port right before the pump, because this medication is going to be regulated with the pump. So clean my port,
And I'm going to pop this.
give
and
it a
also put
good
it
swab
into
for
the sharps
30
container.
seconds.
And now I'm going to use a sterile cap.
Let it dry for 15. And once this is clean, I cannot touch it again. I have to maintain sterility here to connect my port.
Like this. And I'm ready to go to the bedside. So I'm just going to put my label on this.
Okay, so once my port is connected, I will bring down my secondary bag, which is the medication I'm administering, and gently open my clamp to back prime, so I don't lose any medication. So gently open my clamp, back prime till I have about 1/3 to half of the fluid in the chamber, and then I'll close my clamp, and then doing that makes sure that I get rid of all the air bubbles and that my tube is completely primed. So once that is primed, before this I did my calculation, and my final volume for this medication would be 51.2 milliliters, because I'm diluting with 50 milliliters of normal saline, and my dose of medication was 1.2 milliliters. So my final volume is 51, and the rate that I will be running for this pump is 102 milliliters per hour. So I will go ahead and set my rate now.
I'm going to check the site for any infiltration, phlebitis, if there's any pain.
So rate
I'm here today to give you your hydrocortisone for your inflammation. And so I was wondering if you could tell me your name and your birthday. And I'm going to compare
and my
my
final
marks and
volume.
this
My final volume is
and I'm going to complete my first check.
51.2.
So the patient is on the right side, as we said. Hydrocortisone is the medication. The dose is 150 milligrams. The route is IV. And
Okay,
the
so
time
after
is,
I'm done that, I will
every
confirm
4
my
hours, which is
secondary.
now at 3 o'clock. So
After I
Emma,
confirm
I'm
my
just gonna let
secondary,
you
I will
know
just
that
unclamp
the side
it.
effects are nausea and vomiting and pain at the site.
And after I
So just,
unclamp,
for
I'll
you
make
to
sure I
proceed with
watch
this medication.
for 3 drops to see that it's
Now I'm
actually
going to
running.
take my tubing.
I'm just watching for 3 drops. And while watching, I'll just let the patient know that the medication is running now, and then I'll put the call bell beside you here. You can call me if you need anything, and let me know if you notice any changes as well. And by now I see that there's a second drop dropping here, and I'll just document my medications that have been